Let me tell you about data collated by the Ghana National Household Registry, and the indication is giving that about 80,000 poor and vulnerable persons in the Greater Accra Region are homeless. According to a data dissemination report issued by the GNHR, 62% of the vulnerable individuals were female, with about 50% aged between 18 and 39 and about 20% aged between 40 and 59. 10% 60 plus, and the remaining under 18 years. It also reveals that over 60% of these vulnerable individuals sleep in kiosks, containers, markets, uncompleted structures, and that exposes them to natural hazard. We'll have a conversation on these findings. And joining me in studio is Dr. Prosper Larry. He's with the National Coordinator for the GNHR. First off, he will explain to us what their mandate is and how that it affects the living standard of the vulnerable. Thank you very much for coming, Doc. So let's go through your mandate, just so for those who are not very familiar with this organization.
Thank you very much. The Ghana National Household Registry is a unit under the Ministry of Gender, Children and Social Protection. Okay. And one of our key mandates is to be the center of targeting for social protection intervention programs, so that recipients of these programs will be rightfully targeted, and also as to enhance transparency in the process.
Okay, so this research that you stepped out to do, what exactly were you looking for? Then we can talk about what you found.
You know, one of the work we do is to create a database on which poor and the vulnerable can be rightfully targeted. And so we do data collection using a census approach. And Greater Accra was one of the areas that we decided to do what we termed it an emergency data collection, because we did start from the Upper East, Upper West, and now in the Northern region, using a census approach to be able to target almost every other categories there. But this exercise, our main target was the lockdown areas, because you realize that even though Greater Accra does not form one of the highest poverty belt, but the COVID-19 pandemic exposed a lot of people to a lot of shocks, and especially people in the lockdown areas. And so as a ministry, our social welfare department, they have data, but it was necessary that we update our database with these poor and vulnerable groups within the lockdown areas in Accra.
Well, so you only stayed in Accra. I wanted to find out whether your mandate extends to the areas that I just mentioned, where your minister had been, the so-called witches camps. Does it extend to such areas as well, and would it be an area of interest to you?
Yes, currently that is the Northeast region. Data collection is ongoing in those areas. You know, GNHR started in 2015, and it was supposed to pick up data using the poverty profile. And you know, the poverty profile, you have Upper West being the very poorest, and we have completed data collection in Upper West. The next is the Upper East, and we have completed data collection there. We're currently profiling the Northeast, and we've done about 60%. And these areas, those are the people that their socioeconomic details will be taken, and under those profiling, they will be eligible for social protection support.
Let's look at what you found in this research that you did, without giving us the statistics, which tends to be a mouthful and sometimes a little bit, tiny bit confusing if you don't put it in perspective. How would you summarize what you found in a few words?
You know, in a few words, we've been able to profile close to 80,000. We've been able to find out the skills of these people, what they possess, their health status, what they are able to do, where they stay, most importantly. And you get to realize that these people, by updating them on our database, becomes a useful resource for us to use as a ministry and other stakeholders to be able to use this data for targeting of social protection intervention programs.
So based on what you found, how are we aligning our social intervention programs? Essentially, you can talk about the free SHS, that's if it falls within it. You can talk about LEAP, perhaps some others that you can bring our minds to. But how are you aligning the information you gathered so far from your research with the existing social intervention and social protection interventions we have?
As I told you, this was a data we did in line with our social welfare department. GNHR exists to create a database which can be used. And so one of the things we'll be doing is that, for example, the World Food Program, in using this data with our department, is going to give out support to over 50,000 vulnerable groups. Okay. And the basis will be this data that has been profiled because their socioeconomic details have been taken. As I said, we have completed data in Upper East, Upper West, and now profiling Northern Region. So one of the essence is that people on LEAP and LIPW, I told you that one of their mandates is to be able to create a database that will be without bias and with transparency, so that when you are on this database, because we've been able to profile people scientifically according to their socioeconomic status, we categorize them according to poor, non-poor, and extremely poor. And of course, benefits must go to the extremely poor category. So it means that we have afforded another 80,000 vulnerable groups onto our database.
So these 80,000 people, where were they? Why were they not captured in the previous system that I believe we were operating with as far as our social protection interventions were concerned?
What I have said is that picking data is a very expensive venture that takes time. And so that's why we termed it an emergency data collection, because we are going through the poverty cycle. I mean, Greater Accra would have been the last place that we will get to, because you are not saying people are not poor in Accra, but what we are saying is that you want to get to the poorest of the poor. And so these are also people you should realize that when it comes to vulnerable categories, they are very transient. You know, today you can be very rich, sickness or something can change your socioeconomic status. So that's a very transient group.
What is the way going forward?
What we seek to do is to ensure that we work on the regions that are left, for example, Northeast and Savannah and Northern region where our data collection is concerned. You realize that data on the poor and vulnerable remains the biggest challenge. So going forward, we want to speed up these processes so that we can have a very credible and a very quick register in which the poor and the vulnerable can be well targeted.
For those that have taken the time to listen to this conversation, I mean, it's important to have data on which we can take certain action and all of that. But for those that are watching this interview that feel like there's just too much of, you know, technical data gathering terms, etc., what do you want them to take away from this discussion?
One of the things they should know is that now there exists a center for targeting in which when this data is being collected, in fact, yesterday we disseminated our data because the data is as good as its usage. And so one of the things they should also know is that this data do not only serve for purposes of social intervention programs, but we have other indicators in which we know that the MMDAs are using it for their medium-term development plans. And so they can also go on the GNHR website once you want to know the details of this data. Of course, we will not give you data that will expose the individuals because beneficiaries have to be protected. But the non-anonymized ones that are aggregated into very quantitative terms that can be useful for other outlook and other planning, they are things that we can give out. So I think that we have a data sharing protocol, and this data that we share can be used by both civil society, NGOs, and both non-governmental agencies, not only the ones that we use typically for our social protection intervention programs.
Dr. Larry, thank you very much for coming through. Dr. Larry is the National Coordinator for the Ghana National Household Registry there under the Ministry for Gender, Children and Social Protection. And they've done some work that gives us an idea how many people are living in poverty. And he says that by doing so, government will be able to target social protection interventions. Thank you very much once again for coming.